Okay, good day, future nurses. Today, we're going to discuss. Okay, we're going to discuss the continuation of our demyelinating neurological disorders. So we have here your multiple sclerosis. Sabi natin a while ago that your GBS together with your multiple sclerosis, they are actually the same when it comes to their pathophysiological basis. Wherein nagkakaroon po tayo ng tinatawag na demyelination of your myelin sheath. Okay, but first, sabi natin, ano ulit yung ating function of your myelin sheath? Sabi natin yung myelin sheath natin, it covers your axons or your neurons wherein it nagkakaroon ng insulation or it hits the axon wherein it will going to speed up yung impulses natin or yung mga action potentials natin from one neuron to another neuron. So, yun po yung function ng ating myelin sheath. Ngayon, kung sa ating GBS kanina, okay, sabi natin that kung saan yung location na nagkakaroon ng demyelination, it's in your peripheral nervous system. So, in your multiple sclerosis, nagkakaroon po ng demyelination at your central nervous system naman po tayo. Okay, so ang ating multiple sclerosis, okay, it's very common no for patients who are actually tawag dito sa mga kababaihan, and then yung age nila is 20 to 40 years old, and it is actually common also with sa mga, sabi natin kanina, more common siya sa mga female. Okay, and aside from that one, this is a neurological disorder wherein meron siyang periods of remission and exacerbation. Okay, ano bang ibig sabihin ng remission in first place? Ibig sabihin ng remission class, it is tinatawag natin na, wait lang ha. Okay, ito yung tinatawag natin na, pag nagkaroon ka ng remission, ang isang sakit nagkaroon ng remission, okay, wala po siyang mga pinapakitang mga simptomas. That is your remission. Pag sinabi naman po nating exacerbation on the other hand, okay, meron yung sakit, okay, meron pa rin yung sakit natin, but it presents a lot of symptoms, and the worst thing is that nagkakaroon po ng worsening of your symptoms. Yan po yung tinatawag natin na exacerbation natin. So in here class, since ang affected dito is your central nervous system, definitely ang involvement natin dito, okay, ang pwedeng magkaroon ng problema is your what? We have your motor. Nagkakaroon ng problem in your motor, in your cognitive as well, and in your sensory aspect of our nervous system. Okay, yan po usually yung tinatamaan ng ating multiple sclerosis. Nagkakaroon ng problem in our motor, in our cognitive, and in our sensory aspect natin. So what are the predisposing factors that could actually lead to your multiple sclerosis? Number one, you have here your genetics. Okay, your genetics will definitely predetermine, okay, nakadepende kasi yan sa genetic makeup or genetic predisposition para magkaroon ka ng tinatawag na multiple sclerosis. And aside from that one, we also have here letter U, unnecessary radiation exposure. Okay, nagkakaroon ka ng unnecessary radiation exposure. Wherein itong radiation na to class, okay, ang nangyayari kasi dyan, pwede niyang masira or it can actually cause demyelination of your myelin sheath in your central nervous system. And next, you also have here your nutritional deficits or nutritional deficits. Okay, specifically your what? Specifically pag kulang tayo sa vitamin D, no? Pag kulang tayo sa vitamin D, wherein kayo mapapansin natin, no, class, kung saan common ang multiple sclerosis na disorder, common to sa mga places that have a cold season or weather. Okay, mga malalamig na na mga lugar, okay, na walang masyadong exposure sa sun, 'di ba? Wherein your vitamin D, okay, it helps through your sunlight, okay, natutulungan po natin to para magkaroon po ng release of your vitamin D in our body. So, mapapansin natin, very common po itong multiple sclerosis sa mga lugar na walang masyadong araw. Okay, or sa mga lugar na malalamig. And aside from that one, for your letter S, we have here your slow acting virus natin. Okay, we have here your slow acting virus natin. Wherein, pag sinabi natin slow acting virus, ano bang example nito? Diba, we also have your rhabdovirus. Okay, yung causative agent for your rabies. Wherein, although wala pa siyang definitive study, but we can actually correlate your mga slow acting virus natin for you to develop your multiple sclerosis. Okay, aside from that one class, pagdating naman po sa ating pathophysiologic basis, okay, sabi natin your myelin sheath, okay, yan ang tumutulong to insulate our action para mas mabilis yung ating pag-transmit ng ating mga impulses. Ngayon, in our peripheral nervous system, sino ulit ang nagre-release ng ating mga myelin sheath there? Nurses, it's your Schwann cell. Dito naman sa kabila, pag sinabi nating central nervous system, ang nagre-release po ng ating ang nagproproduce po ng ating mga myelin sheaths in your central nervous system, it's your oligodendroglial cells or your oligodendrocytes naman po natin. Okay, so now, when it comes to the pathophysiology of your multiple sclerosis, ganito po ang nangyayari. Okay? Ngayon, sabi natin, what are the two parts of your central nervous system? Di ba, we have your, sulat natin, we have your brain, and we also have your spinal cord natin. Okay, so in your brain, okay, ang affectation po natin or affected the parts ng ating brain pagdating sa demyelination of our myelin sheath in your central nervous system, number 1, naapektuhan po yung ating tinatawag na cranial nerve number 2. Okay, aside from your cranial nerve number 2, naapektuhan din ang ating cranial nerve number 9. And also your also the part of your brain na tinatawag nating cerebellum. Okay, dito tayo sa ating cranial nerve number 2 class. Ngayon, pag nagkaroon ka ng multiple sclerosis, sabi natin, nadadamage, possible na nagkakaroon ng damage with your what? With your cranial nerve number 2, which is yung tinatawag natin na optic nerve. Tama? Tinatawag natin siyang optic nerve natin. Wherein, pag na-damage po ang ating optic nerve, what will happen? Okay, pag nasira po ang ating optic nerve, possible magkaroon ka ng double vision or yung tinatawag natin na diplopia. Okay, nagkakaroon ka ng diplopia or yung tinatawag natin na double vision. And aside from that one, when it comes to your cranial nerve number 9, so yung cranial nerve number 9 naman natin, sabi natin this is your glossopharyngeal nerve. Wherein pag nasira ang ating glossopharyngeal nerve, what will happen? What will happen is that nagkakaroon ka ng difficulty in swallowing that will possibility to what? Possible na magkaroon ka ng risk for aspiration. Okay, so next naman tayo here with your cerebellum naman po. In your cerebellum naman po, class, okay, so alam naman natin that your cerebellum, the function of your cerebellum is for what? For coordination yan, di ba? For coordination of your mga fine motor movements natin, okay, our balance, yan po yung function ng ating cerebellum. Pag nasira, okay, ang ating, pag nasira ang ating mga neurons in our brain, specifically with your, sa ating part ng ating brain, which is your cerebellum, nagkakaroon pa ng incoordination of our movements. Okay, nagkakaroon ng incoordination of our movements. Pag nagkaroon ng incoordination, what will happen? Pag ganito pang nangyari, okay, is that nagkakaroon ka po ng ataxic gait na tinatawag natin. We have your ataxic gait. Ibig sabihin ng ataxic gait natin, that is your inability to balance your body. Saan natin nakikita usually yung ataxic gait natin? Nakikita natin yan sa mga patient na merong, okay, mga lasing, okay? Okay, pag nalalasing tayo, napapansin natin na nahihirapan tayong tumayo, nahihirapan tayong maglakad. It's because our alcohol usually depress your central nervous system and our brain, okay? And our cerebellum is part of our brain. That's why nagkakaroon ka ng ataxic gait na tinatawag natin. Okay, so let's proceed naman po sa ating spinal cord. In your spinal cord naman, class, di ba, your spinal cord is divided into two, We have your sensory, and of course, we also have your motor aspect natin. Okay, in your sensory class, ang nangyayari, since nagkaroon ng damage in your mga axons natin, or nagkaroon ng damage in your myelin sheath, I should say, definitely nagkakaroon ng slower impulse. Okay, nagkakaroon ng slower impulse into your neurons from other neurons to another neurons. That's why pag ganun, nagkakaroon ng slow transmission ng ating action potential. Pag nagkaroon ng slow action potential or impulses natin, what will happen with our sensation? Of course, nagkakaroon ka ng slower respond to, for example, pag ikaw ay natusok, pag ikaw ay napaso, okay, napapasok yung mga tawag dito, napapasok ka, natutusok ka, okay, na hindi mo man lang nararamdaman. It's because very slow po yung transmission or yung impulse na ibibigay ng ating mga neurons to another neuron. That's why yung mga patient natin na nagkakaroon ng MS or multiple sclerosis, nagkakaroon sila ng numbness. Okay, ba medyo same din sila with your case in your tinatawag natin na Guillain-Barré syndrome. But ang problem dito is in your central nervous system natin. Okay, in your motor naman class, okay, pagdating sa ating motor aspect, okay, nagkakaroon yung mga patient natin na merong MS ng chronic fatigue. Okay, bakit sila nagkakaroon ng chronic fatigue, sir? It's because, of course, very slow po yung transmission ng ating mga impulses. Okay? From your neurons to your mga muscles natin. That will lead to what? Pwede sila magkaroon ng spastic paralysis. Okay, kung sa kabila, nagkakaroon sila ng flaccid paralysis in your GBS, dito naman po, sa ating tinatawag na multiple sclerosis, nagkakaroon sila ng chronic fatigue that will lead to spastic paralysis. Okay, ngayon pag nagkaroon sila ng spastic paralysis, that will lead to possible, okay, hyperreflexia. Ano bang ibig sabihin ng ating spastic? Spastic in the first place. Ibig sabihin ng spastic, that is your hypertonicity of your muscles. Kaya nagkakaroon sila ng hyperreflexion, nahihirapan silang i-control yung kanilang mga reflexes. Okay, so that's in your the pathophysiologic basis of your multiple sclerosis natin. Okay, pagdating sa ating assessment, what will happen with our assessment? Okay, nakikita natin sa ating assessment class is that, okay, what is the early symptom? Okay, what is the early symptom of your multiple sclerosis? Don't forget this, nurses. You have to remember this from time to time, that your earliest symptom for your multiple sclerosis is what? We have your diplopia. Kasi nga sabi natin, bakit sila nagkakaroon ng blurring of their vision or double vision? It's because nasisira ang kanilang cranial nerve number 2, which is your optic nerve natin. That's why, pag si patient nagkaroon ng double vision, okay, nagkaroon ng exacerbation ng ating multiple sclerosis, what will happen to them? They have the tendency na mahulog. That's why mga patient natin na merong multiple sclerosis as being manifested, no, yung earliest symptom nila, which is your diplopia, your patient with multiple sclerosis have a higher risk for injury. Don't forget that, nurses, ha? And then aside from that, what is our hallmark sign for your multiple sclerosis? You have to remember this one. Meron tayong mga triad, no? In your medical surgical nursing, mayroon tayong mga iba't ibang triad. Okay, you have your Cushing triad, you have your, in here naman, in your, tawag dito, in your multiple sclerosis, don't forget this, nurses. Ang tawag natin dito, our hallmark signs is your tinatawag na Charcot's triad. Okay, Charcot's yan, hindi Charots. Charot tuloy nalagay ko. We have your Charcot's triad. Ibig sabihin, triad, tatlong simptomas yan. Ano yung tatlong yan, sir? We have here, nurses. Number 1, we have your letter S-I-N, ang ating Charcot triads. Sin po ang ating mnemonics for this one. Letter S stands for what? Letter S stands for scanning of your speech. Okay, that is your scanning of your speech. Ibig sabihin ng scanning of speech, that is just a slow, monotonous speech. Okay, slow, monotonous speech. Kasi nga in the first place, sabi natin, naapektuhan ba ang ating sensory and our motor and our cognitive aspect of our nervous system? Yes, kaya sila nagkakaroon ng scanning of your speech. Meron silang slow, monotonous speech. Next naman for your letter I, we have here your intentional tremors. Okay, bakit sila nagkakaroon ng intentional tremors? Sabi natin as part of your di ba naapektuhan yung ating cerebellum? We're in your cerebellum, that is the ang kanyang function is for your coordination of your movements. Ngayon, pag nagkaroon ka ng incoordination of your movements, pwede ka ba magkaroon ng tremors? Yes, nagkakaroon ka ng mas mabagal na movement compared sa normal one. Okay, and aside from that one, we also have here your nystagmus. Ano naman ang ibig sabihin ng nystagmus natin, class? Ibig sabihin ng nystagmus, that is your involuntary jerking of your eyeball. Okay, anong cranial nerve ang affected dun, sir? Pag hindi mo nakokontrol, okay, yung nagkakaroon ka ng involuntary jerking of your eyeball, anong cranial nerve ang nasira dyan? Meron tayong tinatawag na cranial nerve number 4. Okay, nagkakaroon ng sira or affected, okay, apektado po yung ating cranial nerve number 4 that is responsible for the movement of our eyeballs. Okay, that is your nystagmus na tinatawag natin. Again, of course, meron din tinatawag na classic sign. What is the classic sign for your multiple sclerosis? Meron tayong tinatawag na Lermites. Okay, sulat natin We have your Lermites. Ano naman ang ibig sabihin ng Lermites, sir? Ibig sabihin ng Lermites is just tawag dito. This is your parang electric light impulse from your cervical cord going down. Kasi in the first place, pag sinabi nating multiple sclerosis yan, kung ang ating GBS, ascending ang kanyang characteristics. Kapag CNS, pag tinawag naman nating multiple sclerosis, since CNS ang affected dito, class, definitely descending naman po ang kanyang characteristics. Don't forget that, nurses, sa pag GBS ascending, kapag sinabi nating multiple sclerosis, descending naman po yan, pababa naman po yan. Kasi in the first place, ang nasira po natin dito is ang affected po dito na part ng ating nervous system, we have of our nervous system, we have your CNS po natin. Okay, balik tayo sa ating classic sign. We have your Lermites. Anong ibig sabihin ng Lermites? Okay, that is just a electric light impulse from your cervical cord going down. Ibig sabihin nito, pag yumuyo ko yung taong merong multiple sclerosis, parang nagkakaroon sila ng kuryente na dumadaloy from their cervical cord. Okay, yan pa yung tinatawag natin na Lermites as your classic sign of your multiple sclerosis natin. Okay, sabi natin kanina, no, aside from your mga physical assessment natin, okay, yung mga patient natin na merong multiple sclerosis, okay, sabi natin since affected ang ating cognitive, affected ang ating sensory and your motor aspect, therefore, pwede ba sila magkaroon ng poor memory? And of course, poor concentration? Yes, kasi apektado ang kanilang cognitive aspect of their nervous system. And aside from that one, class, pwede kaya sila magkaroon ng lability, like nagkakaroon sila ng mga mood swings, pwede bang ma-depress yung mga taong merong multiple sclerosis? Yes, pwede pang mangyari yan sa kanila. Okay, next tayo sa ating diagnostic test natin. We have here, of course, same also with your mga neurological disorders natin, same with your GBS, with your multiple, with your tawag dito, myasthenia gravis. Okay, ang ating ano naman dito, class, okay, di ba, parang nagkakaroon tuloy ako ng scanning of vision, hindi naman, okay, wala naman akong MS, okay. Ngayon, dito naman sa ating MS naman, class, of course, pag titignan natin sa ating CT scan and in their MRI, ano nakikita natin? Okay, ano nakikita natin dito is that meron silang mga plaques and scarring or tangles sa kanilang mga neuron. Okay, meron silang mga plaques and tangles na nakikita, okay, or mga scarring in their neuron. So yan pinakikita natin sa mga patient na merong tinatawag na multiple sclerosis. Wherein, of course, sabi natin pag multiple sclerosis yan, sa may CNS ang problem, nagkakaroon sila ng systemic demyelination sa kanilang CTS or CT scan and of course with their MRI nila. Okay, so ngayon class, pagdating naman sa kanilang CSF or with their cerebrospinal fluid analysis, ano makikita natin sa kanila? Nagkakaroon po sila ng increase in their total protein and that indicates na meron talagang problem or meron talagang systemic demyelination in their neurons. Okay, and of course, let's proceed now with your tinatawag natin na management natin. Okay, in our management class, okay, mabilis lang to, no? Of course, ang ating priority, since nagkakaroon sila ng nystagmus, nagkakaroon sila ng tinatawag natin na double vision or your diplopia. Therefore, what will be our priority? We have your safety. Okay, safety ang priority natin dito. Pag nagkaroon sila ng nystagmus, nagkaroon sila ng diplopia, what are you going to do is that you have to patch, okay, one eye alternately. Okay, you have to patch the one eye alternately para hindi sila magkaroon ng tinatawag na double vision. Okay, although mahirap yun talaga sa kanila. And aside from that one, of course, we have here your airway, your breathing, and of course, your activities of your daily livings. Although, ang ating multiple sclerosis kasi class, wala po talaga tayong gamot para i-treat ito. But, ang ating management in here is that, since yung ating multiple sclerosis, ang kailangan lang natin gawin here is that, meron naman tayong mga supportive and symptomatic treatment lang po ang ating dito, class. Okay, so pag magpipiliin tayo, anong mas gusto mo? Okay? GBS or MS? Of course, GBS na lang, di ba? Kasi pag GBS, pwede pang gawan ng paraan yan, ang kanyang prognosis mas maayos compared sa ating MS na very poor ang prognosis. Pag tayo nagkaroon ng MS, definitely this will be already what? Tawag dito, lifetime disease na po ito. Kasi nga sabi natin, meron siyang periods of remission and exacerbation natin. Okay? And aside from that one, what are you going to do? We have to prevent exacerbations of your MS. Bakit kailangan, sir? Bakit kailangan natin i-prevent yung exacerbation? Sabi natin in the first place, pag exacerbation yan, lumabas ang symptoms ng ating, or lumabas ang mga clinical manifestation ng ating MS, but mas malala pa ang kanilang magiging symptoms pag tinawag natin siyang exacerbation. Okay? Ngayon, what is the number one cause? Okay, that causes exacerbation with your patient with multiple sclerosis. Number one, We have your stress. Okay, we have your physical stress. Wait lang, nagloloko yung pencil ni sir. Okay, physical. Ayaw na niya. Okay, we have your stress. Number 1 yan, class. We have your physical stress. So that's why, as a nurse, what are you going to do is that you have to help your client to avoid any physical stress. Ano ba yung mga activities that could actually, tawag dito, exacerbate your patients who have your multiple sclerosis? Number 1. Ano number 1 natin? We have your pregnancy. Okay, we have your pregnancy natin. So, medyo malas, no, yung mga kababaihan na merong multiple sclerosis kasi hindi sila pwedeng basta-basta magbuntis. Bakit? Kasi pag sila ay nagbuntis, it will exacerbate the symptoms or it can even worsen the symptoms of their multiple sclerosis. Next, number 2, we have your extreme temperature. Bakit? Kasi in the first place, pag sila ay na-expose sa mga extreme temperature, sabi natin pag cold, sa mga cold regions, no, very common ang mga tao na nagkakaroon ng multiple sclerosis. That's why we have to avoid them not to what? Not to expose into, may it be very hot region or very hot temperature or cold temperature. And then number 3, we have your tinatawag natin na lack of sleep. Pwede bang magpuyat ang mga patient na merong multiple sclerosis? No. Kasi it can exacerbate or it can worsen the symptoms of their disorder. Okay, kaya mapapansin natin, class, na sabi natin kanina, okay, balikan natin. Pag ano din ang management natin, sir, pag nagkaroon naman ng ataxic gait, yung ating patient. Of course, ang management natin dito, class, is to, para hindi sila matumba, yung mga patient natin na merong tinatawag na ataxic gait because of demyelination of their myelin sheath in their central nervous system. What are you going to do is that you have to, what? Pag nagkaroon sila ng ganyan, pag nagkaroon sila ng tawag dito, pag nagkaroon sila ng ataxic gait, anong gagawin natin sa kanila is that, ang management dito is your wide foot, ano tawag dito? Dapat, para hindi sila matumbay, dapat wide feet apart yung kanilang pagtayo. Okay, para masuportahan pa rin yung kanilang pagtayo. Okay, ganun po yun. Pag dito naman sa ating, sa may sensory natin, since nagkakaroon sila ng slow impulse, okay, para sila magkaroon ng sensation, of course, bawal mo silang bigyan ng mga bawal silang bigyan ng mga masyadong mainit at masyadong mga malalamig na kasi hindi na yun nararamdaman. Meron silang delayed sensation. Okay? And then after that one, proceed naman tayo sa ating drug of choice, okay, sa ating pharmacological intervention. Since ang ating disorder, class, is that, ang sabi natin, no, ang problem natin dito is, it can be an autoimmune, okay? It is an autoimmune disorder. Therefore, what we are going to do is that, since sa mga tao na mayroong multiple sclerosis, their immune system is not already working for themselves. It is working against their body. That's why ang gagawin natin, we are going to suppress their immune system by giving your immunosuppressants. Ano mga immunosuppressants na pwede natin ibigay kay client? We have here, of course, your, sulat natin, azathioprine. Aside from your azathioprine, we're going also to give your steroids. Okay, a very powerful immunosuppressant. And of course, we also have your adalimumab. Okay, we have your azathioprine, we have your steroids, and your adalimumab natin. Okay, and aside from that one, class, okay, what will be the contraindication of this, I mean, what are the complications, of this medication? Since immunosuppressants, they can cause actually, tawag dito, infection. Okay, but sa mag-cause ng infection, it's because they are considered as immunosuppressants. Aside from that one, since sabi natin, nagkakaroon sila ng problem with their muscles, di ba, nagkakaroon sila ng spastic paralysis. Pag nagkaroon sila ng spastic paralysis, okay, di ba sabi natin pag spasticity, ibig sabihin ng hypertonicity of your muscles, we are going to give them muscle relaxants. Okay, bibigyan natin sila ng muscle relaxants. Okay, ano ba yung mga example ng muscle relaxants natin? Okay, we have your, number 1, we have your baclofen. Ano pa? Aside from that, we can also give your dantrium, mga ganyan na gamot. Aside from your dantrium or your dantrolene, we can also give them your, tinatawag natin na flexeril, cyclobenzaprine. And of course, we also have your soma, carisoprodol. Okay, so yun pa yung mga ibibigay natin na mga gamot kapag sila ay nagkaroon ng muscle and their respiratory spasticity. Magbibigay tayo ng mga muscle relaxants natin. And aside from that one, Okay, for your multiple sclerosis mismo, okay, since sabi natin symptomatic and supportive treatment lang ang pwede nating ibigay, we can also give your interferons na mga gamot natin. Okay, ano example ng mga interferons natin? Okay, palitan natin yung sulat ni Sir Pangit. We have your interferons. Anong interference? Ang example ng interference na gamot ang bibigyan natin, we have your Avonex natin. Okay, and it is being administered intramuscularly, and of course, ang ating Avonex, they are being used to, okay, that is actually for maintenance for their possible exacerbation. And of course, you also have your Copaxone. Para saan naman yung Copaxone natin? That can actually decrease your pag-relapse ng ating disorder. Okay, so yan po yung mga medications na bibigay natin for patients who have multiple sclerosis natin. Aside from that one, okay, pag sabi natin nagkakaroon din ng problem with your bladder, okay, nagkakaroon ng spasticity of their bladder. Kung sa kabila, neurogenic bladder, dito naman pa sa ating multiple sclerosis, nagkakaroon sila ng spastic bladder. So pag nagkaroon sila ng spastic bladder, okay, ang management natin for that one, of course, bladder training yan. Kapag hindi kaya ng bladder training, of course, that's the time that we can give your mga medications natin. Pag si patient, nagkaroon ng urinary retention, okay, hindi siya makaihi, we can give your urecolin na tinatawag natin. And of course, pag nagkaroon naman si patient ng incontinence, hindi niya makontrol yung kanyang pag-ihi, okay, nagkakaroon sila ng involuntary voiding, what are we going to give? We have your probantin. Okay, so that ends our discussion for your multiple sclerosis. Okay, tapos na tayo sa ating tinatawag na mga autoimmune nervous disorders.